connect, whatever you choose to believe.
Good morning, everyone. Thank you for taking time to join us. For those that are watching on PCN, we appreciate your joining us here today. As you know, we're gathered here for Childhood Cancer Awareness Month. September represents a lot of things to a lot of people. The ending of summer, the beginning of fall, the beginning of school, and 911 ceremonies. But for a lot of people, it also means something else. And we're here because a lot of people aren't aware that September is also Childhood Cancer Awareness Month. And those of you see standing with me, both my colleagues to my left and some of our supporters, physicians, practitioners, and parents to my right, are here to operate as the voices for some little people who can't be with us today. And I am grateful that they are here. And more importantly, we are grateful for the things that they have done and how they've shared in our lives. It's not just about a month, but it's about some little lives that we want to share some information with. We want to talk about the importance of our Commonwealth investing in future treatment, assistance, and medical care to these young patients. To keep it in perspective, in the state of Pennsylvania, roughly 600 children are diagnosed every year with some form of childhood cancer. While that may not sound like a large number, by tomorrow at the same time, 2 more families' lives will be touched and maybe changed. Some of my friends ask me how I can even talk about things like this, but I chose the word changed because I think some of those changes are for the positive. I'd like to believe, and some of you know, that my family went through this with my young daughter. I also stand here in honoring my good friend Brian Lentz, former member of the House of Representatives, who also went through this with his young boy Joey. And a shout out to Joey and Jen and his wife. It does change your life. The diagnosis changes your life. But you also learn an awful lot. You learn a better definition of the word courage. I've seen young people half my height and 1/4 of my age have more courage than I'll probably ever live to have. I've learned that the definition normal is a moving target, especially in the world of treatment, chemotherapy, and cancer treatment. I've learned to appreciate doctors and nurses better than I ever did when I worked with them, and the hope that these smiles and reassuring pats on the shoulder give to patients. So we're not only here to just talk about a particular month and what it recognizes, not just about the patients, but about the families that are affected. A diagnosis of childhood cancer is not just affecting that child, but affects the family, the friends, the neighborhood, and really our futures. One of the things that my daughter's oncologist said to me recently that really rang a bell with me was the fact that we're talking about years of life that some of these children don't have. My daughter lived to 6. I had hoped she'd live to 86. That's a loss of 80 years. These are our hopes and our dreams. These are our people we hope someday will help find cures for these terrible diseases. But we're also here to celebrate these lives and celebrate the lives of our doctors and our nurses, because without them, we would be lost. Well, this is not about me here today. We have some great speakers. We're going to start with Dr. Camino, one of the local officials from our great medical center of Hershey Medical Center right here in central Pennsylvania, and my dear friend, Dr. Camino.
Okay. Why do we need to raise awareness for childhood cancer? Because every year in this country, nearly 13,000 children under the age of 20 years will be diagnosed with a childhood cancer. That means every day in this country, 50 more children are diagnosed, and about 50,000 children are undergoing active treatment every day. Childhood cancer is wrong, and it makes us uncomfortable to think that the children suffer in this way, and so many of us turn our heads and pretend it does not exist. Cure rates have greatly improved for many types of childhood cancer, but the fact remains that childhood cancer remains the #1 cause of death by disease in children. In 2013, there are still some types of childhood cancer for which cure remains elusive, and no progress has been made in 30 years. For every child who loses their life to childhood cancer, an average of 71 years of life are lost, compared to 15 years when an adult loses their life to cancer. This results in many decades of life that a child does not grow up, does not have children of their own, discover great things, contribute to society, or even find another cure for cancer. This impact is real, and it's felt by too many families in Pennsylvania. Another reality is that the treatment of childhood cancer is very expensive, and the financial impact on families is real. The average time spent on treatment is 2 years, and the costs are in hundreds of thousands of dollars. Treatment often results in loss of income due to parents having to cut back on their workloads while trying to care for their sick child. Despite insurance and public assistance, there are large co-pays and many out-of-pocket expenses. Most children cannot be treated at a local hospital, and families often must face the disruption by moving their treatment to a large children's hospital. So childhood cancer awareness is important because awareness is the first step toward action, and it's only with action that will lead to more cures. We need to increase funding for research, treatment, and for family assistance. We need funding that leads to research that focuses directly on the types of childhood cancers. It is through research that we'll ultimately find more cures as well as safer treatments. So I want to thank Representative Benninghoff and the Pennsylvania Legislature for this proclamation recognizing September as Childhood Cancer Awareness Month. I want to encourage everyone, though, to translate this awareness into action. So here's what you can do. You can support those who are participating in the Million Mile Walk through Alex's Lemonade Stand. You can support your children's efforts as they participate in their mini-thons at their middle schools and high schools. You can throw your change in the cans of all those Penn State students who will be standing at street corners this weekend. You can participate in community fundraisers that go directly to the family assistance or attend a St. Baldrick's event. All these things are available here and now. And for the legislature, I encourage you to go further and make policies that enable all children with cancer to have access to clinical trials, and that we keep in mind that we need to have adequate health care coverage for treatment. And for the families out there who have traveled this journey called childhood cancer, I speak on behalf of all the caregivers when I say it's a privilege to walk this journey with you. Thank you.
Thank you, Dr. Camino. And I was remiss to not give her credentials other than being a dear friend, but she is an associate professor of pediatrics, program director of pediatric hematology, oncology, and fellowship in Penn State's Children's Hospital. And I have to tell you, she is a power-packed individual who gave us a tremendous amount of help and hope at the same time, and I will be forever grateful. Next, we have a very important individual and has one of the toughest jobs in the world, and that is she is a mother, Annette McKeon, mother and president of Amy's Army. Annette has joined us before in some of these proclamations, and we're honored to have her back again today. Annette.
Thank you. Good morning. I'm Annette McKeon, proud mother of Amy Dickey, who lost her battle to a DIPG brain tumor on 12/12/08. I would like to thank Representative Benninghoff and the House for inviting me here today to speak about September being Childhood Cancer Awareness Month. I can stand here and give you statistic after statistic. I can stand here and tell you about the various forms of cancer that affect our children today. I can stand here and tell you that cancers in children get the least amount of federal funding to be shared amongst the 12 major forms of cancer as well as their many subtypes. I can show you graphs that tell you how many children are affected by each different form of cancer, but they are nothing more than a bunch of numbers. Children are not numbers on a chart. They are not statistics on a page. They are human beings who deserve a chance at life, just as you and I have had. This is my daughter, Amy. She was 12 when she passed away from a DIPG brain tumor, one of the deadliest known to man. Amy is not a number on a graph. Amy is not a statistic. I'll never forget her words back in September of 2007, shortly after she was diagnosed, when the chief of residents came into her room After speaking with the students outside her door, she lifted her finger and she said, "Oh no, I am not a number on a folder. I am a child who happens to have a brain tumor. Know me before you know my disease. I am a child first and foremost. I have a name." Her words changed many of the students' lives that day, as well as the chief's way of teaching. Amy enjoyed go-kart racing, cheerleading, reading, writing, and music, but more than anything, helping others, especially during her battle. Amy had hopes and dreams for the future. She would have been a senior in high school today, and she had had the chance to fulfill her dreams. God only knows what her tomorrows could have held. She has a face, she has a name, she is not a number. This is Elizabeth. She was 3 years old when DIPG took her life. Elizabeth loved the color pink and everything country. Elizabeth knew the words to every Kenny Chesney song and was one of his biggest fans. She loved to color and create things on paper just like her daddy. She also loved chickmunks. She has a face, she has a name, she is not a number. This is Brandon. He was 17 when non-Hodgkin's Burkitt's lymphoma took his life. Brandon enjoyed hanging out with his friends skateboarding. He had plans for the future after he graduated from high school. Unfortunately, Brandon never got to experience his hopes and dreams. He has a face, he has a name, he is not a number. This is Sonia. She was diagnosed with osteosarcoma at the age of 14 and relapsed at the age of 19. Yes, Sonia is a survivor to this dreaded disease, but now due to her many rounds of chemotherapy, Sonia is faced with many disabilities that will never be able to have children of her own. Now Sonia is facing cardiomyopathy and will need a heart transplant due to her years of chemotherapy. She has a face, she has a name, she is not a number. This is Abby. She was 12 when she passed from a glioblastoma of the thalamus in the brain. Abby enjoyed cheerleading, reading, playing her flute, and hanging out with her friends. Abby would be a sophomore in college today had cancer not stolen her life. She has a face, she has a name, she is not a number. I can stand here and share hundreds, if not thousands, of children's stories with you. However, over the last 5 years since my daughter Amy passed, I've been told that the numbers of children affected by cancer are not high enough to warrant more funding for research into this dreaded disease. I've been told that just because one area of our state may see higher cases of childhood cancer, it still does not warrant any kind of investigation because 10, 20, or 30 children in one area just isn't enough to matter. In closing, I am here today to ask you to continue to recognize the need for awareness for childhood cancer and to recognize the need for funding for grants so that childhood cancer can be recognized as one of the gravest diseases to affect our littlest heroes today. But remember one thing, these are children, not numbers. Look at their faces, learn their names, and know that they do matter. I thank you for your time and attention to this very important cause.
Thank you, Annette. Very, very well done. Sad to hear the comments that the number's not high enough when at your household, one is high enough. And tremendous information shared with us. Next, we have another soldier marching with us, another strong mother, Jennifer Kratzer. And I know Jennifer has her family, and you're welcome to introduce them as you're here.
Thank you for having us today. 3.5 years ago, my husband and I heard the words no parent ever expects to hear. There is a large tumor in your son's brain. Our son Colin was diagnosed with brain cancer in 2010 when he was just 16 months old. He has undergone numerous surgeries, rigorous rounds of chemotherapy, a dangerous stem cell transplant, and radiation to his entire brain and spine. He has had to relearn to sit, stand, and walk. Over the last 3.5 years, our time has been divided between our children, home and hospitals, and travel to other states for additional treatment. We attend clinic and therapy appointments multiple times a week. Thankfully, we've just reached a first-time milestone, which is 1 full year of quarterly MRIs that show no evidence of disease. I naively believed that cancer could never happen to my child. But I have learned that childhood cancer occurs regularly, randomly, and spares no ethnic group, socioeconomic class, or geographic region. I've learned that cancer is the leading cause of death by disease in children under the age of 15 in the United States. It kills more kids than AIDS, asthma, diabetes, cystic fibrosis, and congenital defects combined. It is important for more parents and pediatricians to be aware of childhood cancer symptoms, even though childhood cancer is considered rare. Common cancer symptoms in children, such as vomiting, swollen glands, bruises, and infection, are often initially thought to be other childhood illnesses, which can delay a cancer diagnosis by weeks or even months. My son's cancer was stage 4 by the time it was diagnosed, which meant that it had spread to his spine. In 80% of children, their cancer has spread to other areas of their body by the time it is diagnosed. This makes it much more difficult to treat and reduces the chances of survival. There are over a dozen types of childhood cancers, and they require specific research to develop the best treatment for every child. Since this takes time and funding, progress has been limited, and for many kids there is still little to no hope for a cure. The cause of most childhood cancers is unknown, and so far these cancers cannot be prevented. Most children are currently treated with similar chemo and radiation protocols as adults are, but these treatments don't always work well for kids because their cancers are completely different than adult cancers. For the children who do survive, 2 out of 3 will suffer from long-term or late-onset side effects resulting from their treatments. Surgery, chemo, and radiation can cause lifelong problems such as learning disabilities, hearing loss, heart disease, infertility, secondary cancers, and more. These disabilities often prevent childhood cancer survivors from fully participating in school, social activities, and eventually work, which can cause depression and feelings of isolation. We need to do better. Our kids, your kids, deserve better. Everyone immediately thinks of breast cancer awareness when they see the color pink. More people need to know that September is Childhood Cancer Awareness Month and the color is gold. We cancer parents are so passionate about raising awareness because we don't want other families to have to endure what we've had to. Awareness leads to increased funding for the research that will lead to the cures that our children, and maybe even your children or grandchildren, so desperately need.
Thank you. Do you want to say anything, Colin? Want to say hello to everybody? You trust me to pick you up? Come here, Colin. You want to say hello?
Want to say hi?
Say hello.
Hi.
Hi. And this is Colin's sister. Do you want to say hello?
Can you say thank you?
Thank you.
You're welcome, buddy. This is Colin. He knows a lot more about courage than I ever will. Thank you, Annette, and Karen, and Jennifer. Karen's going to be next. Before we move on to our next speaker, I did want to take a moment to acknowledge my colleagues to the left here. These are representatives of the House, both Republican and Democrat. They know that childhood cancer and cancer in general is not a partisan issue, but more importantly, earlier this year, this is a surprise to me, they did a cancer fundraising effort. It was a eat off where they ate a 3-pound steak, baked potato, and some other stuff. While it was not a pretty sight, these strapping young lads to my left were skunked by a very thin young fellow of our colleagues, which was great surprise, who did not eat but somehow vacuumed up that meal in less than 11 minutes. If he's still in Hershey Medical Center, I wouldn't be surprised, but to my colleagues, they then donated over $11,000, which they raised in one event in honor of our daughter. And I think that that speaks volumes. Oftentimes you don't hear about some of the good things our colleagues do. These people might wear dark suits, but inside they have very warm, kind hearts. And they do care, and they would not be here. And I thank each and every one of you for being here. Our next batter up is Karen Wilson. She is the head of Jeremy P. Wilson Foundation and a good friend as well, and has a great story to share. Karen, she drove all the way up from down south of the state today, and we are gracious that you took time to do that on a very short notice.
Thank you, Representative Benninghoff, for allowing me the opportunity to share a few brief remarks. I also greatly appreciate participation by Dwayne Milne, who's a representative from my district over in Chester County. October 5th, 2013 will mark my son Jeremy P. Wilson's 5th angelversary, not anniversary. This is how we parents who have lost a child to childhood cancer refer to the day that they became an angel in heaven. Jeremy filled every minute of his short 11 and a half years with life, love, and learning. He was an extremely bright and enthusiastic boy who fought his very rare form of cancer, sarcoma of the liver, with extreme courage, determination, and a positive attitude through every step of his 13-month illness until his last breath in October 2008. 5 years seems like a fairly long time, but to me, his triplet sisters, and the rest of our family and community, it seems like only yesterday that we saw his smile full of joy and heard his laughter and singing. When I think of him now, I can't help but wonder what that small boy with strawberry blonde hair, who always wore a baseball cap after he lost that hair and loved the color red, would look like now. His voice would have changed, and he would have undoubtedly grown at least a foot like some of his friends, and would probably be shaving. Like his two sisters, who adored him, he would now be 16 and a half years old, a junior in high school, and worrying about getting his driver's license, taking SATs, looking at colleges, and getting the nerve to ask a girl to the junior prom. But Jeremy will never have that chance. That vicious monster, childhood cancer, robbed him of his childhood and his future. Every time I hear his theme song, Life is a Highway, I'm reminded of how short and precious even 5 years of a child's life can be. The first press conference I attended here in Harrisburg was in 2010. That was 3 years ago, and 2 years after Jeremy had passed away. At that time, the moms who gathered here and shared their children's cancer stories all had the same message. We're losing too many children to this disease, and we need more funding and more research. So where are we now, 5 years later? We're still pretty much in the same place. The statistics haven't changed. Every day, 46 children and their families hear the dreaded words, "Your child has cancer." Organizations like the American Cancer Society try to convince the public that there's an 80% cure rate for childhood cancers, and we remind them every time that that's only for leukemia patients, not for kids suffering from more rare forms of cancer like Jeremy's. The bottom line is that there's not enough government funding being invested in childhood cancer research to change these statistics. There seems to be plenty of government funding for breast cancer and other adult cancers to help adults who have already lived long and productive lives. But where is the funding for childhood cancer? In 2010, our family established the Jeremy P. Wilson Foundation to honor Jeremy's love of life and learning and help other children to carry on his legacy. Over the past 3 years, we've raised over $40,000, which has been donated to childhood cancer research at AI DuPont Hospital in Wilmington, Delaware, where Jeremy was treated. We've also given several scholarships to childhood cancer patients and their siblings. Many other families who have lost children to cancer have also established their own foundations. It's a start, but it barely scratches the surface, and it can't make up for the lack of government funding. So please do something to help the children suffering and dying from childhood cancer. Every year for the next 5 years, let's paint this town gold until we run out of gold paint and there is no more childhood cancer. Remember, the children are the gold of our future. Thank you.
Thank you, Karen. Very touching, and I appreciate you sharing it. And you are correct. They are the gold. Our last speaker is Lisa McGregor, medical doctor, PhD, clinical director, Division of Pediatric Hematology and Oncology at the Penn State Hershey Medical Center. Doctor, we're very thankful for your service to the community, to our children, and more importantly, for being with us today.
Good morning. Thank you so much. I'm so happy to have this opportunity to talk about something that I'm passionate about. One of the things I'm passionate about is that we have had success in childhood cancer. 50 years ago, a child with acute lymphoblastic leukemia, out of 10 of them, 9 died. Today, out of 10 of them, about 9 are going to survive. And the question is how did we get there for leukemia, and how can we get there for patients like Jeremy? We got there for leukemia by banding together. We got there for leukemia by having doctors that would work together from multiple institutions in order to be able to do trials on what is, thankfully, a very rare cancer, even though it's the most common childhood cancer. And the only way we can do it is by working together in order to find these answers. We got there by having very brave parents and patients, people who are willing to take a chance on a study, people who are willing to say, yes, you can learn something about my experience. Maybe it will help my child, maybe it will help the next child that comes along. But that's how we got there. But we couldn't have come together, we couldn't have worked together if we didn't have support. Some of that support comes from the government. Frankly, your tax dollars do help us study childhood cancer now, and helped in the past, and have helped us reach the successes that we have had so far. Insurance companies pay for children to participate on some of the bigger trials because now it is a standard of care for children to be treated on a research study when they have cancer, if we have a research study available, because that's how we learn and that's how we help the next ones grow. And so I'm here today to raise your awareness of the importance of research, that we have come far, we've done very well, but we have a far way to go. I would really like the day when I don't have to tell a parent, I think I can treat your child, but I don't think I can cure your child. But there's more than that. There are kids who do get cures. And just like was said, because they have cures, they have lifelong problems because of what we had to do in order to cure them. And there's another amount of research that must be done so that we can help these children not only survive, but live and have happy, healthy, normal adult lives. And the only way we can do that is by doing research for their survivors as well. And so it's very important for everybody to be aware. It's important to be aware that your tax dollars need to go to help support this research, to help all of these children and help us increase the cure of these children. It's important to advocate to your insurance companies that children should be allowed to participate in research trials when there's one available, that children should be allowed to go to survivorship clinics at centers that have expertise in helping these survivors have the best life possible. And then it's important to get out there and do what you can to support these wonderful foundations, to support Alex's Lemonade Stand, support Thond and the Four Diamond Fund, anywhere you can that helps us do the research to improve the lives of these kids.
Thank you, Dr. McGregor. Thank you to all our presenters, to my colleagues, Representative Grove, Representative Marabito, Representative Oberlander, Bizzarro, Representative Mill, Representative James, and Representative Payne. I know Representative Roy was here as well. We have representation all across the Commonwealth, and I think it's important that they hear your message. And for those who are wondering what it is that they can do in addition to what the doctor just said, it's not always just about writing a check. But these men and women that stand behind us have very difficult jobs. I frankly don't know how they do it every day. We can always lift them up in prayer, give them the guidance, give them the wisdom, give them the grace to continue going on, give them the strength. Frankly, I don't know how they do it. Give us the courage in the legislature to be able to invest the dollars where we need to be. And as I think both physicians said, we should not be segregating who gets treatment and who doesn't by your economic status or how we reimburse through insurance companies or through our MA system. I want to thank everyone for being here today. Do not let today's ceremony or the House resolution that was passed honoring childhood cancer awareness stop with this ceremony. This is to be a catalyst. You can be these young people's voices. You can be the hope. You can do some of the work that they are not able to do. I want to see Colin back here one day. We asked him if he wanted to be a politician. He shook his head, and I decided he could fill my chair, and I would be glad to step aside when Colin takes over. Colin, know that you'll be in our family's prayers as well as the people stand behind us. And to your families, Amy's Army, Amy, Karen, and everyone else that joined us today, we are very, very thankful very much for you being here. To my members and colleagues, God bless you. Thank you, everyone.